For many who end up in a rheumatologist's office for back pain, all the x-rays and MRIs they have already done aren't going to show them the problem. Why is that? Because the back pain of many who end up seeing me is sacroiliac pain or sacroiliitis, something the ER, urgent care, or even an orthopedist wasn't always thinking about. So today, I'm going to explain what is sacroiliitis, why rheumatologists care about it, and why you should too, and how we can go about finding it. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. Sacroiliitis refers to inflammation, the itis part, of the sacroiliac joints. These sacroiliac joints are the two joints we have on either side of our low back where the sacrum connects to the ilium. The sacrum is just the final section of our spine, and the ilium is the big Mickey ear part of our pelvis. They come together in a joint called the sacroiliac joint, which helps stabilize the pelvis and the spine. This joint is like most other joints in our body in that it can suffer from wear and tear, but also from inflammation. In rheumatology, these joints are of special interest to us because sacroiliitis is considered a hallmark sign in conditions like ankylosing spondylitis. Ankylosing spondylitis, or AS, is an autoimmune inflammatory condition that primarily affects the spine, but it is actually just one condition of many that lie along a spectrum of autoimmune conditions that can affect the back. We tend to call these conditions HLA-B27 associated conditions because they can be associated with the HLA-B27 gene. Now, I have a whole video on the HLA-B27 gene and the blood test, and if you're finding yourself facing the question of sacroiliitis, I definitely recommend watching that next, as it will explain the test and how to think about both positive and negative results. Conditions that lie along the spectrum include AS, but also psoriatic arthritis, inflammatory bowel disease associated arthritis, which is really just arthritis that we can see in those who have Crohn's or ulcerative colitis, also reactive arthritis, or even uveitis, which is eye inflammation. We used to think of these conditions as being completely separate entities, but we now understand that they share some common biology and actually live along the spectrum, with many sharing similar symptoms. And sacroiliitis is one of those shared symptoms. Okay, so what does sacroiliitis feel like, and how is it different than just run-of-the-mill back pain? The pain of sacroiliitis tends to be localized to around where the sacroiliac joints lie. So this means the pain is low back pain, but low back pain that is not so much in the middle of the spine, but on the sides. Sometimes it's on both sides, sometimes it's just on one, and sometimes it bounces back and forth. We can often point to the pain of sacroiliitis with one finger, and if it does radiate, it usually radiates to the butt and not any further. The pain of sacroiliitis likes us to keep moving and gets worse if we stay still for a long time. This means that sitting at a desk or in a car or even on the couch for an extended period of time will aggravate the pain. In fact, most people feel their worst at night when they are lying in bed trying to sleep and they wake up feeling super stiff in the morning. Now, even run-of-the-mill back pain can get you waking up stiff in the morning, but after about 10 minutes, most people feel okay. With sacroiliitis, it can take upwards of an hour to feel warmed up. Sacroiliitis pain isn't the type of pain that comes out of nowhere, but instead it sneaks up on us. It starts mild and then slowly gets worse and worse, and we call this an insidious onset. Now remember, when we are thinking about sacroiliitis, we are thinking along that spectrum of HLA-B27 associated diseases. So we are going to want to pay attention to more than just the back pain. What else is going on, and what else should we pay attention to? Well, first there's the skin. Psoriatic arthritis is along that spectrum, and so we need to look for psoriasis. Many times people may not even be aware that they have psoriasis and just have thought they have dandruff or eczema. So we're going to look for flaky lesions on the scalp, changes in our nails, and no, this doesn't include the ridges that we can get. I'm talking about brittle, discolored nails, or red, flaky, raised rashes on our elbows, our knees, or behind our ears. We are also going to want to know about your eyes. Have you ever had an episode of eye inflammation? I've had patients totally forget to tell me that 2 years ago, they were seeing an ophthalmologist for eye inflammation because it had gone away and they just forgot about it. Well, that could have been uveitis, and I kind of need to know. I also want to know about your gut. Ulcerative colitis and Crohn's disease are inflammatory bowel diseases that can be associated with an inflammatory arthritis, specifically sacroiliitis. So if you've had any issues there, we don't want to gloss over it. And then, of course, any other symptoms or recent infections you've had are going to be important. Reactive arthritis is called that because it's reactive to an infection, most commonly a stomach bug. So any recent illnesses are going to be important to discuss as well. So once we've done a full head-to-toe evaluation, it's time to do some testing to try to confirm the presence of inflammation in those sacroiliac joints. This is usually where patients proudly show me all their previous imaging, hoping I will have everything I need. And where I have to tell them, I'm sorry, I need more tests because this isn't looking in the right spot. So what do I mean? When you see your primary care, you go to the urgent care or ER, or even see an orthopedist for low back pain, it's not uncommon for the first steps to be to do x-rays or even MRIs of your lumbar spine. But let's go back to our anatomy. Although the lumbar spine is right above the sacroiliac joints, the films usually don't go far enough down to clearly see all of the SI joints. Meaning, the radiologist can't make any kind of meaningful comment on what your SI joints look like. This is why being told you have nothing or just a little bit of arthritis on your x-rays can be very misleading and wildly unhelpful when we are looking for sacroiliitis. So what I'm going to do is start with dedicated SI joint x-rays and then likely get a pelvic MRI. If there has been inflammation in the SI joints for a while, we may see changes on an x-ray, but a lot of the time we will need an MRI to get a clearer picture. Now, just a note, as frustrating as it may be, even though an x-ray, MRI, or CT scan is a picture, and you would think it should be easier and clearer to interpret than, say, blood tests, the results still have to be taken in context of the person sitting in front of me. You see, radiologists follow certain criteria in order to write in their reports sacroiliitis consistent with an inflammatory spondyloarthropathy. These criteria have changed over the years as we learn more, and although they aren't always getting better, they are imperfect. Most notably, we can still catch inflammation in the SI joints that looks like AS, but it isn't, specifically in women who are either pregnant or within the first year postpartum. This means that if you are a woman who has had a baby in the last 12 months and has back pain that is concerning for sacroiliitis, an MRI isn't necessarily going to tell you if you have a condition like ankylosing spondylitis. And one final point, if you find yourself going down the road of hunting for sacroiliitis because your doctor is considering AS or any other condition along this HLA-B27 spectrum, as you go hunting, keep in mind that an MRI is great for the SI joints, but for the rest of your spine, an MRI can actually be really confusing. The problem is that MRIs of the spine catch a lot of stuff. We see small disc herniations, arthritis changes, spinal canal problems. These changes are very common, especially as we get older, and can lead us down all sorts of wrong paths as we attempt to find explanations for our back pain. If you and your doctor are hunting for clues for inflammatory back conditions like AS or psoriatic arthritis, it's best to stick to an MRI of the SI joints and x-rays for the rest of your spine. Back pain can literally be such a pain. I've seen so many go down so many rabbit holes looking for answers and come to me with their entire spine imaged and yet not have their sacroiliac joints looked at. This is not to say that everyone needs their SI joints imaged. Just like everything else in my world of rheumatology, you have to ask the right questions to understand if it's necessary. But if you have psoriasis, inflammatory bowel disease, eye inflammation, or other joint problems, or low back pain that prevents you from being able to sit for an hour and watch Severance, like, oh my God, have y'all seen it? It's so good. And your SI joints haven't been specifically looked at, ask your doc if it's worth getting dedicated SI joint x-rays. And if you are already going down this road and have had the HLA-B27 test done, then I recommend watching this video next. Thanks as always. My aim is to provide the autoimmune information you need to make the best health decisions for you. If that's your jam, then I'd really appreciate it if you could like and subscribe, and I'll see you next time.